World War I was a time of chaos and death in the United States. While the U.S. was preoccupied in the war, a flu virus broke out in Spain and eventually spread to the U.S. It was called the Spanish flu, and many citizens thought it was nothing but a small illness. This virus, however, soon spread to almost every state in the country and claimed the lives of millions of innocent people. Eventually, the Spanish influenza killed more people than the war itself. This was a tragic time for the United States because people were unable to stop the rapid expansion, and the medical community was not prepared for the large-scale virus. Although it continued to take the lives of even more people, the United States was finally able to fight against it. The government implemented new and improved programs such as sanitation and vaccination, and research was conducted to prevent a similar outbreak. The deadly flu epidemic of 1918 was a tragic event in the United States' history, but it had a triumphant conclusion, as scientists, doctors, nurses, and citizens, and the government all worked together to drastically improve the medical community. While World War I raged throughout Europe, the citizens of the United States faced another issue, an outbreak of the Spanish influenza virus. No one knew where this illness came from. There was a fear that the Germans were spreading the illness, and others thought that the illness was a result of sin. Dr. Victor Vaughan was told to report to Camp Devens in Devens, Massachusetts, to investigate the outbreak there. He found soldiers coughing blood and turning blue. An autopsy later revealed blue, liquid-filled lungs. Vaughan describes his experience in his book A Doctor's Memories, writing, "They are placed on the cots until every bed is full, and yet others crowd in. The faces soon wear a bluish cast. A distressing cough brings up blood-stained sputum. In the morning, the dead bodies are stacked about the morgue like cord wood." These outbreaks caused panic throughout the country due to the amount of deaths caused by illness. In October 1918 alone, 100,000 people died. Though people continued to die, some officials were unconvinced. Former U.S. Senator of Michigan and president of the New York Board of Health, Royal Copeland, told New York that they were safe and had nothing to worry about. However, not everyone had that view of the disease, as many newspapers and health authorities began to give warnings in order to prevent the spread of the illness. Masks were issued throughout multiple cities in order to prevent the flu from being spread throughout the air. However, they were unsuccessful due to the flimsy material that allowed germs to continue to spread. Because of the illness continuing to spread, panic spread also. Americans began to be scared to talk to one another. Farms, factories, and churches closed down. Stores closed because employees refused to show up. A man was shot because he refused to wear a mask by an angry health inspector. Many thought that suicide was a better option than to catch the illness. People even turned to murder. In Chicago, a man cut his wife and children's throats to keep them from dying from the disease. Multiple newspapers during this time relayed messages to its people, saying that they should not be scared. The Albuquerque Morning Journal gave advice on how to stay away from the flu, and the main piece of advice was, "Don't let the flu frighten you to death," and "Don't panic." Public Health Commissioner John Dill Robertson of Illinois said, "It is our duty to keep the people from fear. Worry kills more than the epidemic." The United States was ill-prepared for such a large-scale epidemic. Primarily, there was no sanitation. People lived in crowded cities or military bases where there was a lot of air and water pollution. These factors helped the flu spread more quickly. The United States Department of Commerce Census Bureau conducted research to prove that the increase in population in the U.S. made this virus the most lethal it had ever been. They discovered that in 1920, the 66 of the most populated cities had 26.9 million citizens altogether, which was 25.4% of the total U.S. population at the time. They also found that those 66 cities had the greatest number of cases and deaths of the flu than all the other cities in America. Also, doctors did not know how deadly the virus really was. In Philadelphia, the Board of Health tried to warn its citizens about the deadly flu, but doctors said there was nothing to worry about and they would keep them safe. They told their people to stop panicking and they should not let the flu frighten them to death. The Los Angeles Public Health Director also said, "If ordinary precautions are observed, there is no cause for alarm." There was also no way of reporting an illness. The Board of Health did not require doctors to keep track of new illnesses, so when this new flu strain arrived, no one knew how to go about it. The U.S. did not even expect the flu to be as large as it was, so no research was done beforehand on how to treat or cure it. The United States did not have the technological tools to go about the flu either. There were no vaccines or other medications that could lessen the symptoms of the flu. Nurses and doctors attempted to save everyone who contracted the virus, but were unsuccessful because there was no clear way to cure it. Scientists and physicians tried to create a vaccine, but none proved successful at the time. One physician gave 25 sick patients hydrogen peroxide, thinking that it would get oxygen into their blood. 13 recovered and 12 died, so it was not used again. While some people were searching for a vaccine, many doctors and nurses were in Europe to treat the soldiers fighting in World War I. Able-bodied doctors were taken out of retirement to try and treat the patients and give their advice on how to help them. Dorothy Deming was a student nurse who worked at Presbyterian Hospital in New York during the height of the pandemic. She describes her experience while she was working there. Because of this, there were only a few senior nurses that were responsible to oversee many difficult wards filled with many different nurses. In addition, many of the wards were extremely overcrowded. Deming talks about this, writing, "Normally our ward cared for 24 patients. Now we had 6 more patients in adjacent bedrooms, 32 very sick women assigned to me and a classmate." Because of the lack of a cure, Deming describes that her primary job, along with the other nurses, was to console the patients. In addition, they learned to judge whether the patients would live or die and act accordingly. However, they were able to give the patients heart and respiratory stimulants. Many home remedies were also created to try and cure the patients. According to Deming, they tried cough medicines such as camphor and oil and caffeine. Unfortunately, many of them were unsuccessful. Although the Spanish influenza was a tragic time for the United States because of the millions of deaths and the realization that this form of the flu was the most lethal it had ever been, it paved the pathway to a better medical community. First off, sanitation improved drastically. Ideas such as washing your hands after the bathroom, getting medicine right away when you're sick, and staying home when you were sick are just a few of the necessary improvements that the United States made to become a healthier country. People who couldn't see a doctor still took precautions to keep them safe and healthy. Citizens gargled disinfectants, wore camphor balls and garlic around their necks, and kept their doors and windows shut during cold weather. Newspaper advertisements were everywhere as well, and some wrote how one way to keep the flu is to keep your feet dry. Camp A.A. Humphreys in Belvoir, Virginia, implemented these same ideas at their military base. Each soldier was given 100 square feet of floor space so that they were not all crowded together. Also, if a person showed just one sign of the flu, the medical unit was called immediately, and they would be treated that day. These precautions worked as the epidemic only lasted 5 weeks of the camp, and there were only 15.5 deaths for every 1,000 soldiers instead of everyone in the camp dying. In addition, the U.S. Board of Health finally started to keep track of illnesses. Doctors were required to report any diseases to the Board of Health, and now the Center for Disease Control is tracking all the different flu strains that are going around the world. The United States also learned from their biggest mistake, which was the fact that no research was done beforehand to learn about the flu. To learn about the particular strain that went around in 1918, scientists recovered tissue from those affected with the virus and transformed it into a strain that was used to test drugs on rodents. This method proved to be successful because they discovered that it was actually a virus, which meant it was non-curable. Scientists began researching different drugs and medicines, and currently, research today is conducted in a similar manner. The World Health Organization monitors and reports illnesses to the whole world, while the Center for Disease Control and Prevention globally reports responses to other health diseases. Scientists and doctors worked together to help improve the medical community. The most important aspect was vaccines. Although scientists discovered that the flu could not be cured, they continued to test drugs and came to the conclusion that vaccines could at least lessen the chance and the symptoms of the virus. This led to the creation of antiviral medication. An antiviral medication boosts the immune system response to the flu and makes the symptoms less threatening. This medication is used today when people get sick, and vaccines are used every year to protect people from the flu. They are usually made in eggs, but not all are successful. According to Dr. Steven Zinner, an infectious disease specialist at Mount Auburn Hospital, the virus is always changing, so new vaccines have to be created every year to be the best at treating it. In addition, it is easier for doctors today to tell if someone has the flu. They only have to do a throat swab and look under the microscope to see. Back in the 1900s, there was no way to be certain. Also, in regards to the flu, doctors are trained how to recognize an outbreak of a similar agent and to know that the flu can mutate and spread to become even more dangerous. The flu epidemic was a tragic yet triumphant part of America's history. Without it, the United States medical field would not be as successful as it is now. With doctors, scientists, government, and citizens all stepping in to do their part, the United States has come back from the numerous losses and has used what they learned to better their community.